This is Bob Serling for 10-Minute Tips for Maximum Health, and today I'm talking with Dr. Peter Osborne. Dr. Osborne is both a doctor of chiropractic and a board-certified doctor of clinical nutrition. He's also the founder of the radio show Alternatives for Health and Wellness, as well as the Gluten-Free Society and NutraMD, which is an in-person and online system to help frustrated patients reestablish their health. With his unique and innovative perspective on functional medicine, Dr. Osborne has been featured on Fox News, Reuters, Alternative Medicine Practices, Up Close, and Focus Magazine. I'm really pleased to have him share his wisdom with us today, so welcome, Peter.
Oh, thanks for having me, Bob. It's a great pleasure.
Well, thank you for making time in your busy schedule. So here's our question for today. What is the single best thing you'd recommend people do for maximum health benefits right now?
The absolute most effective single thing that a person can do, in my experience, 15 years of clinical practice, is to cut gluten out of their diet.
And can you give a couple reasons why they would want to do that?
Absolutely. So gluten is the name of a family of proteins found in grains. So wheat, barley, rye, oats. There are other grains that are classically considered gluten-free, but I also recommend those people avoid those corn and rice and the other grains as well, because there's a form of gluten in every grain, no matter what kind of grain we're talking about. But gluten has been linked to more than 190 different forms of autoimmune disease. And autoimmune disease is the number one cause of death for Americans. It's the number one reason Americans die. It trumps cancer and it trumps heart disease. And so by simply eliminating gluten, you can head off a lot of these types of conditions and diseases later on in life.
Well, you know, it's really interesting. I personally went off gluten about 4 years ago at my doctor's recommendation. It's made a tremendous difference, and just about everybody we interview, from doctors who specialize in cancer prevention to Alzheimer's disease to autoimmune, just about any discipline you can think of, everybody is adamant about cutting gluten out of the diet and just how damaging it can be for you. Could you share an experience or two that you've had with some of your patients, their before and after in cutting out gluten?
Absolutely. So one class of patient that we see very commonly is the patient who has chronic pain situations, things like fibromyalgia or chronic arthritic pain. And they've been to every specialist, they've been to the orthopedist, they've had the injections, they've had the steroids, so they've done all the kind of the traditional modalities of treatment, and nothing at all has worked. And what we see in a lot of our patients is that their pain problems, their migrating joint pains, muscle aches, muscle pains, dramatically improve. And almost overnight, we're talking about in the majority of chronic pain patients, we're seeing dramatic pain improvements in as little as 2 months. So these patients are literally going from chronic pain and the need for high doses of medications to no pain whatsoever. And that's the power of going gluten-free. And literally, we've had thousands of patients in the last 15 years in our clinic come through with that same type of scenario. And one of the other very, very common things that we see with grain and gluten sensitivity is we'll see patients with hormone disruption like low levels of thyroid hormone in women, low levels of testosterone in men. And so by avoiding these grains, by avoiding gluten, their hormone disruption is actually in many cases corrected. And that's corrected naturally because gluten is a natural hormone disruptor. It goes in and it interferes with men's ability to produce testosterone. It interferes with people's ability to make thyroid hormone. And so again, the thyroid hormone, it's responsible for regulating the metabolism. So people with low thyroid have low energy, have more pain, have more weight gain. When they have more weight gain, they have more pain. When they have more pain, they exercise less, and then they have more weight gain. So the cycle just becomes extremely vicious. And so, again, by eliminating these things, we get a lot of patients who again, are suffering from these endocrine disorders, these hormone disorders, and from these chronic pain disorders to alleviate those problems altogether.
Well, that's great. Now, in eliminating such a wide range of things, not only the typical wheat, barley, rye, and sometimes oats, but also your recommendation to eliminate other grains such as corn and rice, that can be a little difficult for people. So what might you recommend that they replace those with?
I don't recommend looking for replacements typically. So, and that's a common thing. A lot of people will look for a replacement bagel, a replacement cereal, a replacement piece of bread. I recommend really gravitating and changing the diet more towards meats, vegetables, fruits, and nuts, and not necessarily even in that order, but those being the primary staple foods. If a person really, really needs a replacement, if they're looking for some different options, there are a number of recipes where we can make bread from flours like almond flour or tapioca flour or arrowroot flour. So those do exist. However, because those types of flours are so high in sugar, and can cause a rapid sugar induction into the bloodstream, I don't really recommend those if they already have a health issue and they're trying to get better.
I see. Well, it's very illuminating, and I obviously fall into that same trap that you just mentioned. I'm usually looking for not usually, but sometimes looking for some substitute as opposed to just going by what feels best in my body, because I know, as you said, that when you use those substitutes, they either spike your blood sugar or they're gluten related, and you may not feel as bad as eating a piece of whole wheat bread, but you're not going to feel great either. So I really appreciate your advice on that. All right, I've got just about a minute left here. Any last thoughts on this that you think would be really valuable for people in terms of gluten or their overall health?
Yeah, I think if a person can look at eliminating the grain and just implementing a 30-day elimination where they're very, very strict, no cheating whatsoever, the proverbial proof is in the pudding. You're going to feel so much better that they're going to make the connection, because once the person can have the ability to make the connection. In other words, they may be in pain for so long, they may be suffering for so long that their pain levels are relative. They don't know what's causing it. They've just come to accept it. But if they can commit to 30 days, they will see a dramatic reduction in pain. If they've got hormone disruption, they're going to see a dramatic improvement in the way their hormones are functioning. But it's very, very important to be strict and commit to that 30 days.
Well, that's great. So we're just about out of time. What I'd like to do now is take a minute and why don't you tell people a little bit more about what you do and how they can get in touch with you.
We are, I run a full service functional medicine clinic in Sugar Land, Texas, just outside of Houston. And if somebody wants to find us to look at how we can help them restore their health, they can go to drpeterosborne.com. We also have a foundation called Gluten Free Society, and that's online at glutenfreesociety.org. And I would also encourage any of your listeners to look for, we have an upcoming book that's going to be coming out on grain and pain, how the two are connected intrinsically, and that'll be published in January of 2016.
Well, fantastic. We've really covered a lot of territory in just a few minutes, and I really appreciate everything you said, and I know it's going to help me personally, and I know it's really going to help our listeners as well. So thanks again for your time today.
Well, thank you, Bob, and thanks for putting this together. This is, I think, going to be a great resource for folks.
My pleasure.